On this Friday night, the federal plan to mobilize production of vital supplies. Hand sanitizers, face masks, and ventilators to be produced in Canada.
Our healthcare professionals really need support.
Plus, the growing fears of Canadians stranded abroad. Livelihoods and companies on the line in Canada and around the world. The UK's bold plan to pay the wages of workers. Plus, first-hand experience with COVID-19.
He won't, unfortunately, be here to see it.
Stories of heartache and hope, and singing their praises.
Promise me you won't stop.
Honoring the heroes on the front lines of this pandemic.
Oh, let your love.
Global National with Donna Friesen.
Good evening and thanks for joining us. We know all of you are having to adapt your lives to cope with this pandemic, and we are too. I'm now working remotely, broadcasting from a balcony in North Vancouver near my home. That's downtown, nice and sunny behind me. All of us at Global News are social distancing because of COVID-19. Now, to the major developments. All the provinces, except one, have declared either a public health emergency or a state of emergency. The U.S.-Canada border closes at midnight tonight. And here's the big picture on numbers. There are now more than 260,000 reported cases of COVID-19 around the world. There are more than 11,000 deaths, and those numbers are rising by the minute. In Canada, 12 people have now died from the virus. There's also a Canadian who died in Japan after traveling on the Diamond Princess cruise ship. In terms of cases, today we hit a grim milestone. More than 1,000 people have now tested positive in Canada. That includes at least 11 who have recovered. The bulk of the cases are in BC, Ontario, Alberta, and Quebec. There were 77 new cases in BC, 50 in Ontario, 49 in Alberta, and 18 in Quebec. Every province has detected the virus now. Though there are no confirmed cases in the three territories, officials there have joined every province except Nova Scotia in declaring either a public health emergency or a state of emergency. Now, those declarations mean different things depending on the region, but generally they give officials more powers to protect the public. Just today, Saskatchewan announced that anyone in that province who violates the self-isolation orders will be fined $2,000. The federal government could also invoke the Emergencies Act, giving it sweeping powers. That has not happened yet, but Prime Minister Justin Trudeau says nothing is off the table. For now, he's urging Canadians to stay home to help slow the spread. As Mike Armstrong reports, the federal government is supporting Canadian manufacturers to adjust and accelerate production of medical supplies.
It is an all-hands-on-deck call from the federal government. Any company that can help with the fight against COVID-19 is being asked to step forward.
We want to be over-prepared, and one of the ways to do that is to build domestic capacity and mobilizing our industry to do so.
Canadian companies that manufacture things like masks, gloves, and ventilators are being told to ramp up production. Meantime, companies in other industries are being asked to look at retooling. Can they shift to making medical supplies? The list of needed products is long, and there's competition to buy them.
Every other country in the world that is preparing like ours is trying to get those items too.
After days of intense negotiations, Canada and the U.S. have agreed to close the border effective tonight at 11:59 Eastern. Any travelers trying to cross for tourism or recreation will be turned around.
Trade and commerce will continue.
Keeping supply lines open and food and medicine moving is a priority. Truckers entering the country don't have to self-isolate. They are, however, being watched.
They are routinely being checked as they cross the border to determine if they, in fact, are symptomatic.
Another change to the border is at Roxham Road, the irregular crossing south of Montreal. Canada and the U.S. have agreed to temporarily start turning back asylum seekers, handing them over to U.S. Border Patrol. Now, the government is still scrambling to bring stranded Canadians home. There are fewer and fewer flights from some countries, and from others, none. Getting a plane in to pick people up isn't easy. Some countries are locked down.
We will have more details to share, but the first flight will be picking up Canadians from Morocco this weekend.
This has been a very rough week for the airline industry. Flight crews are working under very difficult conditions, wondering if they're putting their lives in danger. I spoke to a Canadian crew overseas today. They went last night taking Europeans home. They'll come back this weekend with Canadians. But while they were there today, they got their layoff notices by email. Donna?
Very tough times. Mike Armstrong in Ottawa, thanks. Ramping up testing is critical. It's the only way to know how widespread the virus really is. Federal money is supporting an Ottawa company that is developing a portable diagnostic device that, if successful, would provide rapid test results for COVID-19.
If successful, its diagnostic platform and COVID-19 test could be used in airports and in clinics. The device could read the test result within potentially 30 minutes.
Getting more tests, including one for antibodies to this virus, so we know who has had it and recovered, is going to be key to keeping people at work. Having so many people at home unable to work will have an economic impact unlike anything this country has ever experienced. David Akin joins me now. David, what are analysts saying about how bad this could possibly get?
Well, Donna, Canada was in an economic expansion that was its longest in history, produced an unemployment rate that was the lowest in generations. And now, forecasters believe we are about to have an economic contraction that will be the steepest in our history, possibly producing unemployment rates we haven't seen since the 1930s. Canada's flagship airline, Air Canada, is telling 3,600 flight attendants to stand down. There will be no work for them in April. At Air Canada's Rouge airline, all flights are grounded next month, putting more than 1,500 out of work. In businesses large and small, in dozens of different sectors, and in all regions of the country, employers are simply unable to keep all their employees on the payroll. The result? More than 500,000 applications for employment insurance this week alone. By comparison, just 27,000 filed for EI in the same week last year.
I know people are anxious to get the help they deserve, and our government is working as fast as possible to support them. This is, of course, an unprecedented situation, and it's putting a lot of pressure on our system, but we're on it.
The national unemployment rate was just 5.6% last month. It is easily on its way to 8% now and may climb higher. One key focus, Canada's oil and gas sector. It directly employs nearly 70,000 in Alberta, Saskatchewan, and Newfoundland and Labrador, and employs hundreds of thousands indirectly across the country. Global News has learned that federal officials, their provincial counterparts, and some of the country's biggest energy companies are frantically working on a support package to literally save the oil and gas sector the way the auto industry was saved during the 2008-2009 fiscal crisis. And sources close to the talks say this is a Team Canada approach to saving the industry that could yield a rescue package valued at $15 billion or more. And all sides say they hope to hammer out a deal in days. Donna?
David Akin in Ottawa, thank you. And while so many Canadians are losing their jobs because of COVID-19, Walmart Canada is hiring 10,000 workers to meet a surge in demand. The retailer says it needs more staff in its stores and distribution centers, jobs ranging from sales associates, bakery workers, cashiers, and overnight workers. Some grocery stores are taking measures to provide some separation from customers and staff. Sobeys and Safeway have ordered thousands of plexiglass screens to be installed at their checkouts. Physical distance does slow the spread, but the World Health Organization stressed again today countries need to go after the virus itself. Test people, find patients, trace contacts, isolate, and quarantine. In the United States, the restrictions there are ramping up, though public health experts say it's not happening fast enough. The U.S.-Mexico border is closing to all non-essential travel, and two of the largest states, California and New York State, are effectively shut down. President Trump has been touting an anti-malarial drug as a treatment for COVID-19. It hasn't been approved for use for that by the U.S. FDA, and today the director of the National Institute of Allergy and Infectious Diseases was asked if it might be effective as a treatment. He said no.
Is anecdotal. It was not done in a controlled clinical trial, so you really can't make any definitive statement about it.
It may work, may not work. I feel good about it. That's all it is, just a feeling. I'm a smart guy. I feel good about it, and we're going to see. You're going to see soon enough.
There are now more than 15,000 confirmed cases of COVID-19 in the U.S. More than 200 Americans have died. As our Washington Bureau Chief Jackson Proskow explains, that country is on track towards what happened in Italy.
As New York, California, and Illinois close businesses and tell people to shelter at home, the U.S. is telling all travelers to stay away. closing both the northern and southern borders to all non-essential travel. A move coordinated with Canada and Mexico that will last indefinitely.
We want to make sure that cargo continues, trade continues, healthcare workers continue to be able to traverse that border, but tourism, some recreational activities and other things need to stop during this crisis.
President Donald Trump insists there's no talk of a nationwide lockdown, at least not yet. But the U.S. remains on the same grim trajectory as Italy. The number of cases effectively doubled overnight. The number of deaths climbed above 200.
What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter. That's what I say.
Nationwide, there's criticism that testing is still too hard to access, and confusion as to whether the president has, as he has claimed, ordered companies to ramp up production of masks and ventilators to meet a nationwide shortage.
Who's going to take care of the patients? This is a national emergency.
There's also simmering controversy in Washington. Several U.S. senators are now under fire for selling off millions of dollars in stock holdings before the markets tanked. Some attended a classified briefing on the threat of coronavirus in February. A $1 trillion economic rescue package also hangs in the balance.
We need a full unemployment insurance so that when you're laid off, you get paid your full salary, you can get on unemployment quickly.
As life grinds to a halt, it's now an anxious waiting game, as America waits to see if these unprecedented measures will stave off disaster. Jackson Proskow, Global News, Washington.
And now to Europe. Italy has reached another grim milestone. More than 4,000 people have died there now, the most of any country. And in the past 24 hours alone, 627 people died. The rest of Europe is struggling to deal with the virus, too. As Redmond Shannon reports, the UK is now taking extraordinary measures to protect its people and the economy.
This is social distancing, London style. Crowded lineups of grocery shoppers. But everything is about to change in the UK. Schools closed on Friday, 2 weeks after Italy, and almost everything else will soon be suspended, including the British pint.
Telling cafes, pubs, bars and restaurants to close tonight as soon as they reasonably can.
It's a nice pint.
It will be weeks before we know if it's too little, too late. But the British government believes extraordinary financial measures are also needed.
Government grants will cover 80% of the salary of retained workers, up to a total of £2,500 a month.
That's more than $4,000. The immense catastrophe unfolding in Italy is what the world is trying to avoid. But these scenes are almost certainly coming to much of Europe now. The army has been deployed to enforce the lockdown in Italy's Lombardy region. And these are some of the efforts in Spain, as the death toll there tops 1,000. If Europe and its wealth appears powerless against this hidden enemy, then the developing world may fare even worse. The virus is now taking hold across Africa, where public health systems are especially weak.
It's hard to avoid social distance. It's very hard. In Africa, that's part of us. We love togetherness.
Encouragingly, China has slowed cases to a trickle, but Hong Kong has seen its largest daily increase since the outbreak began. Most cases are residents returning from abroad, including skiers who had visited Whistler in British Columbia. A reflection of how this pandemic is now moving in every direction. Redmond Shannon, Global News, London.
Stranded, anxious and demanding action. Coming up, Canadians stuck abroad and desperate for a way home. The federal government estimates about 3 million Canadians work and live abroad at any given time. Many of them have come home. Others are desperately trying to get back now. The Prime Minister insisted today the government is doing everything it can to help. As Ross Lord reports, Canadians stuck overseas want immediate action.
For Chelsea Whitacombe, a vacation has become an ordeal. She and her friend Clifford Robinson flew from Ontario to Peru on March 11th. When they learned how bad the coronavirus outbreak was becoming, they tried to shorten their stay, rebooking the next available return flight for March 18th. But on the 16th, Peru closed its borders.
What we're really hoping for
is that the Canadian government can send planes for the hundreds of Canadian travelers here in Peru to get home before the situation evolves even more than it already is.
They're afraid. They don't speak the language, and they're running out of supplies. They wonder why other countries have picked up stranded residents and Canada has not.
The longer we stay here, the worse it's going to get. They're going to restrict us more. I don't know if it's going to, I think it'll just get harder to bring us home the longer we stay here.
These 3 backpackers from Halifax, including 2 firefighters, are also stranded. They're holed up in a hotel room, resisting the urge to panic as police officers and soldiers enforce Peru's martial law, forcing everyone to stay inside.
The situation's changing on a daily basis. The first day we were able to go out in public and go grocery shopping. Second day, not really permitted unless you're by yourself, and the situation's getting ever more restrictive.
The federal government says it's doing its best to bring Canadians home.
We're in discussion with Canadian Airlines to help Canadians stranded abroad come home. We will have more details to share, but the first flight will be picking up Canadians from Morocco this weekend.
But a statement from Global Affairs suggests Canadians stuck in countries whose borders have been closed might be forced to wait indefinitely. Ross Lord, Global News.
Stories of sorrow and survival ahead, the victims of COVID-19. Most people who get COVID-19 do recover, and we'll hear one person's story tonight. But a beloved grandmother and a vibrant 51-year-old father are among the first Canadian victims of the virus, and their families are now sharing their grief. Heather Urix-West reports.
Sean Cunnington had been feeling sick for several days, but when he sought treatment at a hospital in Milton, Ontario, no one suspected the father of 3 might be suffering from COVID-19.
They looked him over and told him he had pneumonia and I guess sent him home.
Cunnington's symptoms never improved. He went back to the hospital days later and was put into intensive care. By the time a test confirmed the 51-year-old had the virus, he was dead.
He just released a song not that long ago on Spotify and Apple Music, and unfortunately, he won't unfortunately be here to see it do well.
Cunnington had chronic leukemia, so he was more vulnerable than most to the illness. But what's most concerning is officials have no idea how he got it. In Quebec, 82-year-old Mariette Tremblay died after contact with a recent traveler. On Facebook, her family asked that people follow recommendations to stay home. We didn't get a chance to save Grandma, but you have the chance to make a difference now that we know.
I just kept sleeping and coughing and not having any appetite.
74-year-old Karen Schumacher was awaiting test results for COVID-19 when she finally called 911. The BC woman developed a cough weeks after returning from a cruise, but her daughter says it was days before doctors were able to confirm that Schumacher had COVID-19.
The isolation was really hard for her because not only was she not getting any answers, she was feeling really, really sick really fast.
I remember asking one of the nurses when I was first at the hospital, am I going to die from this? Because that was my fear.
Schumacher spent several days in hospital on oxygen before her condition improved. Her diagnosis was confirmed just before she was cleared to go home. She's now recovering in isolation, unsure of how long she'll have to stay there. Heather Urix-West, Global News, Calgary.
Scrubs are the new capes. Next, the global gratitude for healthcare heroes. Among those at greatest risk from this virus are the people who take care of us. When the rest of us stay home, they go to work. To honor their dedication, there are calls for Canadians to open their windows or step outside to applaud all the doctors, nurses, and healthcare workers. Eric Sorensen reports on the essential workers called to duty in this dangerous time.
Their jobs are difficult in ordinary times. Frontline workers overlooked for the comfort they bring and the risks they take. In this extraordinary moment, we are reminded of their simple bravery. In China, Dr. Li Wenliang sent out the early warning, then stood his ground in the face of COVID-19, and then died. The outpouring for him a recognition of the sacrifice that would soon be required all over the world. In this country, health workers are answering that call. Nurses in Ontario, retired, part-time, full-time, more than 4,000 have responded.
I am not surprised that my colleagues have stepped up to the plate in this amazing way. I am inspired by them.
Frontline workers warned us the healthcare system wasn't fully ready for this, but now that a pandemic is upon us, they're swallowing their frustration and staring down their fears.
I think there is fear. I think that's normal. But I also think that there's a sense of duty. This is what we trained for.
Remember the first responders on 9/11? When people fled the Twin Towers, firefighters ran in. Today, those are the healthcare workers. In Italy, more than 2,600 have been infected. In the hardest hit countries of Europe, Italy, Spain, Paris. The appreciation has been genuine and spontaneous. The troops going to this war are inspiring musicians.
You and me, we're still here.
From Bono to Yo-Yo Ma. The doctors, nurses, social workers, emergency responders, all of them know what they're getting into. And any one of us could soon find ourselves looking up from a bed to say, help me, and thank you for being here. Eric Sorensen, Global News.
It's clear we're at the start of something we've never lived through before, and it will touch all of us in some way. From the Prime Minister in self-isolation to the families grieving their loved ones, the first Canadians to die from COVID-19. We know there will be more. We know this virus is going to be with us for months. We'll all find ways to cope and to adapt, and we at Global News are going to be going through it with you, covering every angle. And every night, my goal is to leave you with something to nurture your soul. Tonight, it's the kids. Words of hope, doodles, rainbows, and funny faces. They're popping up on windows everywhere. The hashtag is From My Window. Flashes of optimism we all need right now. Thanks for watching, and take care of yourself. Bye-bye.